All right, good afternoon, everyone. This is Robert Hess III. I am an independent consultant, and I have been asked today to provide an overview of the strategic prevention framework, as well as discuss needs assessments as the first piece of a multi-part series that we're going to be doing together over the next couple of months. And so this is training number one. I believe that there are 6 or 8 trainings on the docket between now and July. And so today's going to really serve as kind of the foundation of a lot of what we will be building off of over the next couple of months together, actually. So on your screen, you should be able to see the PowerPoint. Again, I apologize that the actual display is not as clean as I would have preferred. I tested it earlier this morning and everything was great. And then, of course, I went to open it moments before this presentation and it is not great. So you should be able to see the text, which is the most important part, but you're missing out on all of the pretty pictures. So a little bit about my background, and I'll keep this all very, very brief, but I have about 15 years of experience working in health and human services. A significant chunk of that has been working in the prevention world. I'm based in Arizona. In Arizona, I have advised and worked with the state health department, the governor's office, and probably half a dozen or a dozen or more prevention coalitions, organizations, contractors, health plans, etc. On a national level, I've also done a significant amount of prevention work, having worked directly with SAMHSA, the U.S. Department of Health and Human Services, even the White House a couple years ago. I've done some stuff related to HIV prevention on an international level with the World Health Organization and the United Nations and the Philippines. And so collectively, I think even now with in the state of Arkansas, I think it's been about 6 years or 5 years that I've been conducting technical assistance and training in partnership with UALR and a number of other conferences and different things. So hopefully some of you and I have met in person. I apologize that we are long distance today. But I say all that to say that my experience is very broad, and I think that it brings a nice, what's the word I'm looking for, encyclopedia of sorts of prevention strategies, of how different states operate these coalitions and how other communities invest in prevention strategies, both on a macro level and then also even down to an individual level. So we should have a really robust conversation today, hopefully. So I'm really excited to get started. So the company, I'm going to skip over this. You'll get a clean version of this PowerPoint. You can see again in my consulting world, I do a number of different things across the country. So the goals for today are really to provide an overview of the strategic prevention framework. Now, I recognize several of the names on our attendees list. So I know that some of you have participated with us previously, and I hope that you'll be able to contribute to this discussion today around your understanding of the strategic prevention framework, kind of its application. The slides themselves, I'll just give you an FYI, the slides for today are relatively standard because I really wanted to facilitate a conversation. And so I'm happy to see that a lot of you do have microphones that are accessible or are on the telephone, and maybe you can verbally communicate with us and share your insights and thoughts. But then also, of course, we have the chat box where you're able to contribute and typing if you have other things, if a particular topic strikes your fancy, so to speak. So we're going to do an overview of the strategic prevention framework. We're going to talk through evidence-based practices and strategies for conducting effective needs assessments. And then, of course, we're going to discuss opportunities for the continued use of that needs assessment. So hopefully it's not a document that sits on the shelf and collects dust, but hopefully it's a living document that gets visited frequently and used constantly, and really is a part of the activities and the work that we're doing every day. So we're going to dive in right here. So as you guys know, the Strategic Prevention Framework was founded or initiated by SAMHSA. It's an evidence-based model, and in a lot of ways, the strategic prevention framework is really a process model. And again, I apologize, there was a couple of other widgets and bells and whistles on the side of this slide that are not visible right now, but the strategic prevention framework as a process model really does follow a lot of similar like community change frameworks, quality improvement frameworks, and some of the other well-known approaches to making significant changes, whether individually in your personal life. You could use this model almost as a therapy model if you needed it, but also within an organization. And then how we apply it most often is within communities, but also up to the state level, the bigger picture of communities as a whole or multiple communities. And on a national level, obviously SAMHSA uses this as their approach for how they address prevention issues, not just related to substance abuse, although that is a primary focus of the strategic prevention framework. So the 5-step model starts with an assessment, which is the piece that we're going to talk about heavily today. And then it goes into capacity building, which capacity building for a lot of folks, that term gets used very commonly. And I think it's one of those things that lots of people say, and everyone has a different definition for what capacity building means. So when we talk about capacity building, we're going to get there. In a later presentation, we'll talk in depth about it. But capacity building from the perspective of SAMHSA and the strategic prevention framework is really about like the stages of the readiness dial and stages of change. And so really about creating awareness around a particular issue. For example, if your rural community recently was becoming inundated with heroin use. Of course, in rural communities, everyone knows everyone, and people feel very strongly about their roles in the community. And so it would be difficult if you had a large amount of community leaders that didn't buy into the idea of substance abuse prevention or heroin abuse prevention if they didn't think that heroin use was a problem. And so the capacity building would be some of the engagement of those individuals. Maybe it does include some of the education and awareness. And again, I don't want to confuse it too much because, of course, education and awareness can also be one of your implementation strategies on a larger level. But capacity building is really focusing about the individuals that are around the table and making sure that the coalition has the capacity to address, to enter into strategic planning and really address the needs that need to take place or the issues that are that have been identified in their assessment. So again, we're going to talk in depth about capacity building in a couple of weeks. And so please feel free to shoot questions into the chat box if you have them today. And I can use those definitely to help inform the development of our content in a couple of weeks, or I'm happy to answer them for you today as well. So the way that the strategic prevention framework flows is that once the organization or the coalition has completed their assessment, obviously we've identified what the issues are in the community. We've done some capacity building around those issues. So do we have the right people around the table that are really experts in rural Arkansas heroin use? Or do those experts exist? Do we need to get someone from a more urban setting within Arkansas? Or do we need to get someone or take some time talking with someone in a rural setting in Louisiana that happens to have a lot of expertise in this area? And then once we know that we really have the knowledge and expertise and the right people around the table and the right people in the room, we enter into strategic planning. And again, we're going to talk extensively about planning in a couple of weeks. But of course, strategic planning, which I'm sure most of you guys are very familiar with, is the process by which we look at our needs assessment, identify kind of where the gaps exist and where the needs are in our community that are unmet. So there may be, a huge need to pass out toothbrushes at the local homeless shelter, but if 15 local churches are already doing that, the need is legitimate and it exists, but it's being met by all of these organizations that are already addressing that need. needs. So we really want to focus on unmet needs, and then identify goals, activities, and strategies, or if you want to be really proper about it, goals, strategies, or objectives, and then activities. Activities are the most detailed layer for most folks, on what exactly we're going to do to help address that. And in the planning stage, you want to be really concise and real detailed, and we'll talk in way too much detail about strategic planning in a couple of weeks. I want to take a quick pause and ask if there are any questions so far. I know we're just a couple of minutes in, but I already feel like I have spewed way too many details to not stop and take a breath. So are there any questions so far about the strategic prevention framework, where it came from, how it was started, why we use the strategic prevention framework? Are there any? You can go ahead and type them in the chat box if you have these questions or any other questions. Or for those of you that have a microphone or on the phone, you can hit that little green microphone, or I guess it's probably gray for you, the little gray microphone icon in your control panel, and unmute yourself. All right, doesn't look like there are any questions, so we will keep on chugging. So the strategic planning is really about kind of the lay of the land and outlining what you're going to be doing, over the course of a year typically. Of course, you can strategic plan for 5 years, 3 years, but the 1 year plan is going to be the most detailed. In my company and in some of the organizations that I work with, we actually create quarter-to-quarter plans, or even really intense years, even month to month. What are we going to accomplish each month? So we can take incremental baby steps on where we want to be and how we're going to really accomplish these very big, lofty goals. So once you have a strong plan in place, we move into implementation. Now, the SPF Strategic Prevention Framework is really wise in its approach to look at these as very concise phases or stages, because while some things may happen concurrently, of course, you may be doing capacity building throughout the entire tenure of this process. And of course, you're going to reassess the community on a consistent basis. Maybe every year or every 3 years, you do a big formal needs assessment, but month to month, things are going to come up and change in your community, hopefully as a result of your efforts, and hopefully they're good changes. But you're going to constantly be reassessing. But to follow the process in a very concise manner, there's a word that is escaping me, so you have to forgive me. Agile is the word I'm looking for. So in agile project management, for example, you do one phase at a time, or it's called rapid turnover project management. And sometimes those are 4 weeks, or rapid cycle management. And you do things typically in 4 weeks. So we're going to focus on this phase for 4 weeks, and then we're going to cut over and we're going to start this next phase all over again. And they're totally different, and they have to happen in sequence. So that's kind of the model that the strategic prevention lays out for us, that we'll spend 3 to 6 months doing the needs assessment, and then we're going to chunk that, and once that's over, we're going to move into capacity building. And we're going to focus our efforts on capacity building for X amount of time to make sure we have everything that we need in order to move into planning. And once we do that, then we're going to sunset capacity building, and we're going to move into planning. And then we're going to do planning, which typically is the shortest phase. Hopefully, it should just take a couple of weeks at most. And then once planning is over, we're going to sunset planning and move into implementation. And implementation is typically going to be your longest phase. And you're going to hopefully be spending almost 9 to 10 months of the year focusing on implementation. And so this is when you actually execute all of the things that you said you were going to do, which is very simple, but it's where all the work happens. So the theory behind the phase is simplistic, but the actual work of the phase is far more laborious. So, and in this is when you're going to, realize that maybe there's some things that we planned that aren't going to work and don't make sense, or that people aren't responding well to. So we want to reassess or really this leads us into our evaluation phase a little bit. We want to evaluate the effectiveness of these strategies that we came up with. We thought it was a great idea to go door to door and put door hangers on everyone's door, but people are yelling at us and we've gotten 3 tickets for trespassing. We probably want to reconsider this. Uh, and so I've heard it all, and that stuff actually has happened to people. And so, reconsidering and constantly doing your evaluation during implementation. So that's kind of the continuous quality improvement process that happens during implementation. And then once you've accomplished your goals, or when the year ends, typically you kind of pause implementation to go through a formal evaluation process. I definitely, there's I want to stratify these 2 concepts. So there's the continuous quality improvement, where you're constantly assessing things as you're doing it. So, how are things going with the training? Are people showing up? Are people liking it? Are they receiving it well? Are people learning things? And we do that every time we do a training, and that can be every week, every month, whatever that is. And that's the continuous quality improvement process. Whereas what we're talking about with evaluation and using kind of our agile management approach is we are actually pausing implementation and doing a focused, targeted outcomes evaluation of our work. And we started this year with our plan thinking that if we pass out 1,000 flyers at the local movie theater, that we would be able to reduce adolescent marijuana use by 5%. Did we actually see that happening? And so the evaluation process, of course you want to have some baseline data, but then you also need to use some tools, hopefully not as robust as your initial assessment, but some level of a tool to really kind of document and capture what is the outcome of the work that you've done. And again, we're going to talk extensively about evaluation in each of these phases as we move forward. So please feel free, if there are any questions, to type them in the chat box for me, or to unmute and just interrupt me. That's okay too. So at the center and the core of the strategic prevention framework are these 2 concepts of sustainability, which is definitely something that I get calls about on a regular basis, or emails from coalitions all over the country that are really asking, how do we sustain our efforts? We have this one very limited funding source, and it's not enough. The need is so much greater than the resources, or we're dependent on volunteers. We're meeting in a coffee shop or in someone's living room, or on the street, just as we run into people, we're doing outreach, but we really are wanting to, because this work is so important to us personally, we're really wanting to kind of ramp up and make sure that this work is able to continue. And that's what sustainability is about. And sustainability is at the core of this because it should be something we're thinking about at all times. In every step of the process, during our assessment, during capacity building, during planning, implementation, and evaluation, sustainability should be on the forefront of our mind. And this is sometimes it's hard to think about sustainability in a really concrete and constructive manner. And a lot of times, at least what I've experienced personally as well as professionally, is most folks that work in this field do so because of a very close personal attachment. So I'm sure if you were to sit back and think about either your own experiences or the experiences of individuals around the table, at your coalition meetings, or even at other entities or organizations that are involved, I'm sure if you've had any time to chat or talk with them on a personal level, you've learned that somewhere along the line, there is a very close connection to substance abuse or suicide or HIV or whatever the primary issues are, child abuse, whatever it may be that your coalition has functioned in. So what makes that difficult is really scaling and focusing your efforts on what are sustainable strategies, so that we're not just putting our finger in the dike, so to speak, to plug up a hole, but really finding a way to change, make systemic change that's able to last well beyond the extent of the funding that we have, or even our own life cycles. I mean, I think most of us hope that the work that we're doing leaves some form of a legacy or some form of long-term impact. And that's what sustainability gets to. Cultural competence is another really critical component, and we have a couple of sessions lined up to talk about cultural competency. They are towards the end of our syllabus for this kind of multi-session course that we're headed down. But cultural competency is a lot of things to a lot of people. Ultimately, and the best way to describe it is the good old bumper sticker that says it doesn't cost anything to be nice to people. But not just be nice to them, but also make sure that their needs are genuinely met. And so I don't believe, and please correct me if I'm wrong, because my information is very old. But for example, in Arizona, where I live, about 40% of our population is Hispanic. And a very significant chunk, I think 15 or 20% of folks, English is not their first language. And so when we talk about cultural competency in Arizona, there's a lot of attention put on language access support. So making sure that if we're making a flyer that talks about substance abuse, that we're also printing it in Spanish or making it available. If we're doing a trainer, that there are interpreters available that can help folks that may not speak English. But this is so much more than that. If you look in your data, and your needs assessment will help point you in this direction. But if you were to stratify by population, I am confident you would find that there are racial and ethnic populations, or age group populations, or even gender-based populations that are disparately more inclined to use and abuse substances, or again attempt suicide, whatever your focus is. And so making sure that our outreach campaigns are age appropriate. If we're working with an adolescent audience versus an older adult audience. Again, even the means and methods of our communication, if you're working with 18 or focusing on 18 to 24-year-olds, well, the primary form of communication for that age population is social media and Facebook. But if you're focusing on older adults who may be abusing substances and potentially even overdosing to commit suicide, they're not on Facebook. And so social media campaign doesn't make a lot of sense when working with an older adult population. So those are, cultural competence means a lot of things. It's not just race and ethnicity. Veteran status is a whole nother thing. We're going to do a whole session on LGBT identity, specific to the lesbian, gay, bisexual, and transgender community, because that's a whole nother world. And so as we walk through this process, it's important that our mind kind of always stays on sustainability and always stays on cultural competence to make sure that what we're doing makes sense. And with that, I'm going to pause again briefly to see if there are any other questions or anything that you guys, any questions that you have or comments you would like to make so far. Again, you can type them in the chat box, or you can unmute your phone. All right, we're going to keep plowing, but I assure you that in a couple slides, I'm going to start calling on people. So please feel free to contribute whenever you are ready. So the model of the strategic prevention framework, it was specifically designed to promote youth development. It's been evidence-based and tested, so we know that it reduces risk-taking behaviors. It builds on assets, and it builds resilience in communities, which resilience protective factors and resiliency factors are the things that we know help increase prevention, or reduce, I should say, at-risk behavior. Obviously, it prevents problem behaviors across the lifespan. And so that's also another important component, that the strategic prevention framework, while it was intentionally designed to focus on adolescent substance use, it has actually been proven to work across this age spectrum, as well as on a number of other issues. So this model gets used in other communities, like I said, to address suicide, to address HIV. I worked with a series of city health and human service departments, 9 cities across the state of Arizona, their county governments and city governments, and they were using the strategic prevention framework to help reduce social isolation among older adults. And there was some loose association with suicide prevention, but it really was just about helping folks feel connected. And we use the same model as our kind of conceptual framework. And so, as you guys know, again, the strategic prevention framework, it pulls in things from public health, it pulls in prevention, it pulls in a lot of public administration components as far as building healthy communities. If you look at environmental strategies, a lot of them do come from a healthy communities approach, and those two concepts are almost inseparable in the way that they're written. And so I'm not sure the extent to which you guys have seen some of the creative strategies that folks use, but for example, one of the things that a community that I worked with a couple of years ago did, one of their main approaches to reducing substance use was to design and develop walking trails in their community, and specifically intergenerational walking trails. This was in a rural community, and they had lots of land. There was lots of dirt everywhere, and really good scenery and stuff. And they designed, they were able to partner with the city, and they were able to convince the city to help them build some trails that older adults from the local senior center would be partnered with teenagers, and they would do mentorship and volunteer programs together to really kind of build and reinforce the relationship. And then it was built around physical activity. So lots of really good, positive, pro-social bonding, creating of role models. It was a really unique program that was very effective. But that's a really nice example of how kind of a public health approach was matched with a public administration approach, or kind of even a public policy on a municipal level, to bring these two worlds together and kind of make a healthier community overall. So I definitely encourage you to think outside the box as we go through the not only just the needs assessment, but also the planning phase. And again, we'll talk about that in just a couple of weeks. So according to SAMHSA, the Strategic Prevention Framework, the steps require that states, territories, tribes, communities, that we systemically assess prevention needs based on epidemiological data, which I know it's very common in needs assessments, and we'll talk through this in a second, to look through like county health statistics and the vital records reporting, to look at deaths that had intoxication or substances, DUI rates. These are all very standard kind of data points that folks incorporate into their needs assessments. Really looking to build their prevention capacity, and this is the prevention capacity of their community. As we discussed, developing a strategic plan, actually implement the strategies on the plan on a programmatic, on a policy, and on an individual practice level, and then of course evaluate their efforts for outcomes. So I think we are about to diving into our needs assessment. So before we switch gears a little bit and start talking explicitly about the needs assessment and the needs assessment process, I'll take another pause. What are your questions or thoughts about the strategic prevention framework? And I am going to call on people unless someone is really boisterous and wants to jump in here. But did the information that I shared kind of align with your understanding of the strategic prevention framework? Were there any kind of nuances or new things to you that you weren't aware of previously? You'll keep each other safe by participating. Otherwise, I will pull some names. And again, you can unmute your phone or you can type in the chat box. All right, here we go. So Pam Plummer, I'm going to pick on you only because I know that your microphone works. So if you don't mind, I'm going to unmute you. And if you are able, if you would, it looks like you need to unmute yourself as well. But give me your feedback or your thoughts on kind of what we've discussed or your understanding of the strategic prevention framework. Were there any specific?
Can you hear me?
Yes, we can hear you. Talk to me, Pam.
Okay. No, yeah, great. Thanks for picking on me. No, it's great. It's what I have learned about before, but not very much. So it's very helpful for me because it's not only a review, but that I'm learning a bit more about all the details, and it's good.
Perfect. Thank you. I appreciate it. And I apologize.
Sorry, I don't have much to add. I'm not a spiff expert, but I'm learning.
No, but that's the point. We really want to, I mean, obviously the point of the training is to help folks learn, but if there's, was there anything specific that you found interesting or that clarified stuff for you?
Well, I can't wait for the more on sustainability. I know that probably comes at a different day, but that's always a very important
Perfect. All right.
factor.
Thank you so much. I'm going to put you back on mute and you can mute yourself if you would like. And we will keep on plugging. But I definitely will be calling on more folks as we continue. So, um, as you know, so the strategic prevention framework, what's helpful is that as we start thinking about each one of these steps, so as we start talking about the needs assessment process, really start thinking about it in where it's at in the process. And so needs assessments are the very first step. And so a couple of years ago, I think it was 2009, I worked with a startup coalition that had never existed before. They had just been extended, or they'd just been asked if they would like to form in a particular community. The health plan in that community got funded by, they received SAP block grant dollars, which is how the strategic prevention framework is funded. And, you know, they didn't have enough coalition. So they approached this group of folks and they said, you know, would you guys like to convene and start a coalition? You know, we're going to offer you some funding. And they said yes. And so I was pulled in for the first meeting of this coalition. And you know, when you're first organizing, I don't know how many of you are participating in groups that have been around for a long time, or at least have been around longer than 24 hours, and have some familiarity with the strategic prevention framework, because it was a very fascinating experience. You know, as these community members, I think we had about 40 people show up to this initial, essentially a town hall for this community to talk about, you know, starting a coalition and really wanting to focus on substance abuse prevention. And so, you know, the uncertainty and the confusion and the layers of knowledge or understanding of what the issues actually are and what the issues aren't. And of course, people had their biases and their own priorities. You know, folks, some folks wanted to focus on suicide, and some folks wanted to focus on HIV, and some folks wanted to focus on older adults, and other people youth, and some folks people of color, and you know, just a very diverse group of folks, all with different kind of priorities. So as the coalition started forming, obviously the first step was to complete this needs assessment. And so the needs assessment is really designed to give you the lay of the land. I normally have a slide, and it may present itself back in another presentation in a couple of weeks, where it focuses on we don't know what we don't know. So if you guys know the 4-quadrant model of what you do know, what others know that you don't know, what you know that others don't know, and then what you don't know. And that's always the risky area, or the highest risk area, um, you know, because we can't plan for it, we can't address it. And so that's what the needs assessment is really designed to do, is really to help identify what are the things we do know, what are the things that other people know that we don't know. That's where, you know, some of these components come into place of what we're going to talk about. What do we know that other people don't know, so we can help share information? But then let's really dive in and get deep on what don't we know that we don't know. And so in the needs assessment process, of course, you know, the first step is you want to define the scope. So if that's a particular target audience, if it's a geographic area, I know Arkansas has, someone type it in the chat box for me. How many counties are in Arkansas? 75. All right. Arizona has 12. 75, yes. And so, and I believe, someone give me a yes or a no, but am I correct that the coalitions and stuff are still based, they're county level, correct? So 75 counties means 75 coalitions, roughly? Lorraine, you may have to, yeah, okay, that's what I thought. So, and so maybe, you've already been provided some of the geographic scope of your project, your coalition, but of course you're going to focus on youth, you're going to focus on adults, you're going to focus on African Americans or people of color, you're going to focus on, whatever subpopulation or target population you work on. So you want to define that scope. That in and of itself can take weeks, especially if you're a new group that has not had to go through this before, and you have people with multiple or varying interests all in the room and participating together. The next step is, once you know that we're going to focus on African American youth, that's enough information for you to start looking at what do other people know that we don't know. And that's really where doing a literature review comes into mind. For you guys, actually, in preparation for today, I pulled up the state of Arkansas's Behavioral Health and SAP Block Grant, which is a very fascinating document. I will make sure that Lorraine has it, though I'm sure she already has it, and make it available to you guys, because it's about 540 pages of information about behavioral health and substance abuse within the state of Arkansas. And it outlines, of course, what the state's priorities are. And again, I'm assuming you guys have at least heard of this or are familiar with it. But if you haven't, this is essentially the state of Arkansas's proposal to the federal government, to CMS, to receive the money in order to fund your coalitions. So prevention is typically funded, and Lorraine, fact check me if I'm wrong, but this is just how it works in other states. I'm almost positive that this is where you guys are coming from too. But the SAPT block grant, it stands for the Substance Abuse Prevention and Treatment Block Grant, is federal dollars that go to the states in order to fund substance abuse prevention, which is you guys, and treatment, which is what some of the providers would be doing. And so, anyways, it's a really good synthesis of information that you guys would definitely want to look at for localized information if you haven't already done that. But also looking at what is research shown are best practices for doing prevention with African American teenagers. Again, if we're assuming that that's our target population, because we're pulling in cultural competency, we're pulling in age demographics, we're looking at, you'd want to look in rural communities, what has been done, or in urban settings, depending on where you're located, and really try to get as much information as humanly possible about what do other people know that we don't know, because then now you're educating yourself. So then you're able to take the culmination of all of that information. Now, when I've worked on needs assessments before, the literature review process is very robust, and I really, really advocate for a very, very robust literature review. And to me, robust is reading at least 100 articles. And so if that is empirical research, if those are best practice guidelines, I have literally, I used to walk around with a case, like a case of paper, but it was filled with research. And I would take it to every meeting that I went to. And anytime someone had a question, we'd pull it out and we'd start diving through it and digesting it. And it really, this is also, I'm bleeding a little bit over into capacity building, but this mechanism and this literature review of what do other people know that we don't know, this is building the capacity of your coalition. And so by constantly educating and sharing most recent, up-to-date, evidence-based information with your coalition, you're making them stronger because they then have more concrete data to help inform decisions. And whether that's frameworks, whether that's knowledge, maybe there's a study that recently found, that African American youth are more inclined to, smoke marijuana if they're found, or if they have an adult peer or mentor role model or whatever that smokes marijuana. is a very interesting finding. Maybe it applies to your situation, maybe it doesn't. But if in a couple of steps or in a couple of weeks when you're working on your strategic plan, you can use that to inform an education and outreach program to caregivers and mentors, not just necessarily parents, but grandparents, aunts, uncles, older adult cousins, older siblings, all those types of things. And so you're using that data to inform your process. You can't do that if you're not first pulling it all, reading the data, but then also disseminating it amongst the coalition. So I'm a super big advocate for literature review. Do it, don't stop doing it, do it every day. And there's really great tools out there. Google Scholar is fantastic. Of course, there are some publications that you have to pay for. I don't do that. Don't do that. There's no need to do that. You'll find another one that quotes it or is similar or will give you the same type of concrete data. But also looking at what other coalitions are doing, reading each other's needs assessments, learning, again from each other locally within the state, but then also looking at other coalitions around the country, pulling stuff from SAMHSA. SAMHSA's website has a fantastic amount of literature available on prevention, on research, on best practices, on the strategic prevention framework. Of course, not everyone is as much of a nerd as I am, and I recognize that. You're welcome to laugh if you'd like. But someone in the coalition is going to be interested in diving into that data. And so, if you start sharing it, you're going to find someone that really grabs onto it, if it's not yourself, and gravitates towards, reading and researching this type of stuff. And then let that be their job. Their job is to look up current research and literature and share it with the coalition. And maybe every couple of months they throw together a PowerPoint or training or, just disseminate knowledge with the team, because that's going to help you get better. Enough about the literature review. I apologize. You can tell I'm a real big nerd. I just spent like 20 minutes talking about data, and I'm off topic. So, once you know what other people know, you've now learned what other people know that you previously didn't know. It's time for you to go into this. We don't know what we don't know, and that's where a number of strategies come into play. So, hosting focus groups. By definition, you typically don't want a focus group to exceed 12 people. But of course, I've done focus groups with 50 people just because it's the nature of the beast. You host a town hall, you don't know how many people are showing up, and wow, there's 50 people here. And so hosting those focus groups are great ways to get open-ended feedback. So of course you want to ask open-ended questions. Never ever ask yes and no or closed-ended questions, not multiple choice. You really want to let people talk and hear their stories. Because based off of these focus groups, and I definitely recommend focus groups should be the first step because they're the most broad and the most open-ended. So you're going to hear people talk, individual personal stories about their child, that was an addict, and if they had only, if their teacher had only had more information. While someone may share a 10-minute story, the punchline of that story or the impact for you is really hearing that if their teacher only had the information, because that informs you that schools are an opportunity, there's a need to educate teachers, and that can become a strategy later on in the process. So I definitely recommend focus groups. You can do 1, you can do 10. You do want to focus on a smaller crowd. You want to structure some questions ahead of time. Make sure you know what you're walking in there to ask. If you can find a skilled facilitator, absolutely recommend that. Otherwise, reach out to me and I'll give you some pointers. I'm happy to offer some tips to folks to help them become better at facilitation, because it's a great skill and it gets us the information we need. So focus groups are the most open-ended. The next thing you would want to do after the focus group, and the reason you do it second, you don't have to, but it's just my recommendation or my personal preference. The reason that we would do key informant interview second is because I can walk into the key informant interview and say, hey, we're hearing from the community, that teachers are a real big opportunity to help identify substance abuse issues or do early intervention. You, substance abuse clinician with 20 years of experience, who's really, really smart and has been treating addiction for 20 years, what are your thoughts on that comment? So now you have an expert to pick their brain and to say, we're hearing these things and we're starting to slowly funnel down this information, pare it down. So the literature review gives us literally the entire scope of the world, everything that everyone has ever written or knows about substance abuse and prevention. The focus groups bring us into our community. What are the top 25 things that are going on in our community? And then the key informants are able to help us pare that list down. What are the things that you really think? And again, key informants are experts. They should be people that really know. Now, that doesn't mean they have to be professionals that work in the field. A mom who has put their child in and out of rehab 4 times is an expert. Maybe not an expert from a medical perspective, but her personal life experience probably far exceeds that than anyone that hasn't had to deal with that situation. So a key informant can be anyone that you think really has a high degree of knowledge and insight into the trends that your community is seeing. Again, a perfect example, if you're headed towards a direction of teachers being kind of your gatekeepers to help you with prevention messaging, go interview the principal and ask, why don't teachers do this? Because you might identify the barriers. Well, there's no funding for it. They're overworked. They're underpaid. They don't like this concept. They just want to, they're beating kids in the middle of classes. Whatever. You might find out that teachers are really your enemies in this process and not going to help you at all. And so key informants can be anyone that really is able to help you pare this list down a little bit. And then surveys, the last kind of approach or technique we're talking about today, they can be used for a number of things. So I've used surveys at the very beginning of the needs assessment process. So after we do the literature review, do a survey to identify big trends, then do focus groups to start paring it down a little bit and end it with key informant interviews. You can absolutely do that. Another approach would be the way that this is structured on here is you do your literature review, you pare it down with your focus groups, you get your key informants to give you really specific goals, ideas, and strategies. And then you use the survey to ask your target population, will this work? So again, we'll just use our same example. If we've had all these conversations, we've done all this research, we've done focus groups and our key informant interviews, and everything is leading to, training teachers on how to identify adolescent risk behavior and do prevention, early intervention, or whatever, help them, manage prevention programs. You could use a survey to first survey the teachers to say, are you willing to do this? Do you think this is reasonable? Do you think you have the skills? Do you think this is a viable strategy? And you can also interview the students or survey the students, to say, is this something you would buy into? How do you feel about your teachers also having this dual role? What is your perception of teachers' knowledge? Do you look up to your teachers? Are they actually the role models that we think that they are? Will they have the influence we think they'll have? Etc. So surveys are very powerful tools. Of course, you want to design it appropriately. SurveyMonkey is a very excellent. You're going to be completing your evaluation today's training in it. There's a free version, so you can make it online. You can, of course, use paper. It's just more labor intensive. There's lots of options for you to be able to complete a survey. And so if you've not done it before, I definitely recommend it. We're going to keep plowing because I'm looking at time and I am talking way too much about data, but you guys gave me a topic I'm really, really excited about. So, once we can collect all this information and collect all this data, again, depending on your statistical skills, or if there's anyone in your coalition or your department or a friend, or your partner, husband, wife, that's able to help you run the data and kind of play with it. Again, SurveyMonkey will do some very basic charting and graphs and stuff for you, which is nice. And I have seen dozens of needs assessments from coalitions that just simply use those charts and graphs out of Survey Monkeys. So the responses come in and then they just automatically graph them for them. And that works. I mean, you don't have to get too deep into, significance testing and multivariate analysis and all that stuff. But the thing that you really want to look at, and this is the largest driver for coalition and community-based prevention, is really looking at the most significant trends impacting the most people. So one thing that very commonly happens, at least in Arizona and other parts of the country, I've seen it happen, where people get really scared of like heroin and meth and bath salts and these really intense, dramatic substances. And they have a high lethality. There's a lot of significant crisis episodes. Of course, I'm sure most people are familiar with the individual in Florida who was on bath salts and attacked someone on the freeway and ate their face off. In Phoenix, there was an incident a couple months ago where a guy was high on meth. He was also schizophrenic, but he was high on meth, and he amputated his arm and plucked out his eyeball and decapitated his wife. And so it got a lot of media attention about this particular individual, and people attributed it to the substance. But when you actually run the data, less than 1% of people who are using substances are using heroin, are using meth, or are using bath salts. And that's just in Arizona. Again, I'm not as familiar with what Arkansas's data is, but I'm communicating this to say that while those are the most extreme cases, they're also the minority of the epidemic. And this is where epidemiology comes in and why SAMHSA specifically cites it. So while 1% of people, or less than 1% of people, are abusing bath salts, and those people are doing some really erratic things, 40% of people, have smoked marijuana in the last 30 days, and 60% or 70% of people have drank alcohol. And then, of course, cigarettes is going to be up there as well. And so those become much more significant epidemiological issues within the community when you look at the most significant trends impacting the most people. The next way to look at this, and this is hopefully, we're bifurcating and pulling data or stratifying data out a little bit, looking at the most significant disparities impacting marginalized groups. So while, alcohol may be the most common abused substance, it's primarily, 70% of everyone uses alcohol. And we'll just use the 1% again. So 1% of people use heroin, 70% of people use alcohol. But if you dive into the Hispanic community, ages 20 to 25, 30% of people that are Hispanic, ages 20 to 25, use heroin. So that creates a huge disparity. 1% of the general population uses heroin. 30% of Hispanic individuals 20 to 25 use heroin. So that's a significant disparity in the marginalized population, and that's something that we would also want to focus on. I hope you guys are all able to follow that. For the sake of time, I'm going to keep plowing, but you definitely want to spend a good amount of time and get some statisticians or some folks that are good with numbers and data to help you think through your analysis. Again, reach out to me. I'm happy to offer some tips if you need it. I'm going to go over this very, very quickly. And it's just really talking about resource mapping and gap analysis. So again, if, I forget the analogy I used earlier. If there are, if we identify in the data, that 70% of people need toothbrushes, and that's a really significant issue. But we have 25,000 organizations handing out free toothbrushes, where you get every convenience store, Circle K, and 7-Eleven across the state to start handing out free toothbrushes to folks. While there is a significant need, the need is reasonably being met. And so again, this is where we're taking kind of the disparity perspective. So looking at resource mapping, we really want to look at who is out there that's dealing with these issues. So 70% of people are using alcohol. Well, there's a significant DUI campaign in place. There's a significant don't drink and drive. There's all kinds of different things. You know, there's a task force, and the police department's really taking a strong, or the sheriff's department's taking a strong arm towards alcohol use. So maybe we decide, well, there's a big need. It's being addressed reasonably. So we're going to focus on those disparities within our specific community. So again, looking at resource mapping in the state of Arkansas, in that block grant application that I'm going to make sure Lorraine has, and of course you can reach out to me and I'll get it to you, there is a pretty robust map and list of all of the contracted or licensed providers, both on a substance abuse treatment perspective as well as on a behavioral health treatment perspective. Now, these folks it's unlikely that they all do prevention work, but they do become partners in the work. And so you may be able to reach out to them, be able to get some of those subject matter experts who maybe they are substance abuse treatment counselors or therapists or clinicians, doctors, maybe it's a detox facility, and they can either serve as your key informants in your needs assessment, but it can also help you identify where the assets exist within your community to help you be able to address the needs. This is a very generic way to kind of approach this. So if your needs assessment, which is that gray column, identified that you need to have I'll just use the second line. So based off of the needs, we need 3 substance abuse therapists to really address the needs in our community. Well, and you look, column A, C, and E equates you have 3 substance abuse therapists in your community that are working. So the need is being met because you need 3 and you have 3. So again, if DUIs are a really significant issue, but the police department and the sheriff's department is taking that on, maybe it's already being addressed. And I know that's very subjective and it's very hard to kind of conceptualize that and even to quantify it. So it's just something you guys are going to have to take into consideration and use your key informants to talk through and use your community needs assessment to really help define that, to identify what's the most significant need impacting the most number of people, and then what is the most significant disparity impacting marginalized populations. We are completely out of time, and I apologize. I had hoped to have time for some additional questions and answers, but you guys let me talk about data today, and so unfortunately I got carried away. I will open the floor for just a moment if anyone wants to unmute or if you want to type some questions in the chat box. I would gladly take those. Also, again, you see the link to the evaluation, so you do need to complete that in order to get credit for participating today. Lorraine has also put that evaluation link into the chat box. I tried to make it easy, so it's surveymonkey.com/r/UALR prevention. I was hoping that that'd be something somewhat memorable. If you're not sitting at your computer, you probably want to jot that down so you can do it within the next 48 hours so you can get credit. I've also put my email address and my cell phone number are both on this last slide. So once I figure out what happened to my PowerPoint and I get it all pretty again, I will send this out to Lorraine in a PDF version so you guys can have that. And then I'll also include a copy of the Behavioral Health and SAP Block Grant application for the state of Arkansas. I'm sure 400 of the 540 pages are going to be really bland for you, but that 100 pages, specifically that list of resources, some of the maps and some of the other data that they've included is going to be really rich content that will help you hopefully better understand either your individual county or at least what some of the statewide perspectives for prevention really are. And those are always good things to have in your back pocket. So are there any questions before we officially adjourn for today? Again, go ahead and unmute or type them in the chat box. All right, then without any further ado, I appreciate you guys taking the time to meet with us. I'm going to let you get back on your way. Again, please email me or call me. Lorraine has my information as well. I look forward to our next training, which will be coming up, I believe, in 2 weeks. So if you've not registered, oh, I apologize, it's next week on the 27th. So if you've not registered, reach out to Lorraine and she can get you that information so we can get you registered. And that one's going to focus on capacity building.